So, if you're just now joining us today, pull up a chair, pour yourself another cup. Let's get to know Karen Russell from Mountain Valley Regional Rehabilitation Hospital and Lynette Hoyt here for her annual MS Walk on behalf of the National Multiple Sclerosis Society. Karen, Lynette, thanks for joining us today. Lynette, what exactly is MS?
MS is an autoimmune disease where the body attacks the central nervous system. So essentially, your central nervous system is like a power cord to a lamp, say, and your body is attacking itself, kind of eating away parts of that connective tissue that protects it all. So what happens is when the pieces are pulled apart, is usually when people have issues with mobility, cognitive issues, and that sort of thing. And there's no cure. So that's why we walk.
Is it safe to say that the brain is sending messages that the destination isn't receiving in full?
Correct. Yes, it's short-circuiting essentially. Yes.
Indeed. And Karen Russell, of course, you are at the Rehabilitation Hospital in Prescott Valley, MVRRH. How can rehab help MS patients?
Well, we can help in a lot of different ways. I think one of the most important things for people to understand is when you have a progressive neurological condition, if you start to notice yourself having increased difficulty with your activities of daily living, sometimes people feel that, well, that's part of my disease process and I just have to deal with it. But there are a lot of different interventions that from a therapy standpoint we can work on, whether it be modalities, it could be working on strengthening, it could be working on balance, it could be working even on adaptive equipment, because there might be some things that we can address and increase your function, and we really want to keep you as independent as possible, and just by giving you adaptive pieces of equipment, that might help.
Now, Lynette, Karen mentioned functioning. Now, you are a functioning MS patient yourself, correct?
I am.
At what age did you know you had MS, and how did you find out?
Well, I actually was diagnosed at the age of 33, 8 years ago, and I had optic neuritis, and I had an eye issue previous to that, and had I not gone in for a follow-up, I would have never known, because my symptom went away. It was just some blurriness in my vision. And so a lot of what my story is about awareness. If you have issues that you're not really sure what it is, or go to the doctor and find out. Mine went away for, you know, after a couple weeks. I really thought I nicked my eye with my mascara brush or something. I just didn't even think about it. And then, you know, there's a lot of times it does go away. It may not come again for 5 years, but when it comes back, it doesn't usually come back quite as easy. You know, it's a little bit harder. So it's better to have that diagnosis early so you can get treatment earlier.
Tell us when and where the MS Walk is.
Walk MS, it's our 10th anniversary this year, is starting at the VA this year, not Yavapai College. We've switched locations. It's at the center circle. You can't miss us. There'll be signage. There's 3 different routes this year. So the one route, the longest route, does still go through Yavapai College, and it's 3.6 miles. So it's actually a pretty good hike. And then the 2 other routes are through the VA. So they've been great to work with, and we appreciate both locations on there.
And are these routes fully accessible?
Fully accessible, yes.
All 3 of them, great.
Absolutely.
Karen, what affects people with MS in the extent that they may need physical, speech, or occupational therapy?
Well, as Lynette was saying, there's just a disconnect between the transmission from your brain to your muscles, and it can cause anything from tremors to spasticity, weakness. So it could be an occupational therapist addressing the tremors, and tremors could be, it's going to affect maybe your eating, you know, because you're trying to eat. It could affect you putting toothpaste on a toothbrush. So it might be something as easy as giving you weighted utensils, putting wrist weights on your wrist to help with those tremors. Physical therapists might work on strengthening balance. Spasticity can be very painful and can really limit your function because how it affects your joints, decreases your range of motion, so it decreases your ability to move functionally. So a therapist might work on different techniques to help either splint or relax those muscles and help keep them from getting worse as far as contractures go.
Lynette, what Karen just described, sometimes people will attribute to the natural aging process or perhaps to things that have happened in terms of falls or injuries which affect us physically, but that's where the doctor diagnosis comes in, isn't it?
It is, and MS mimics a lot of other other diseases. So you really want to have a clear cut, you know, finding out why are you falling, why is your balance off. It may have nothing to do with MS, it may just have something to do with some other diagnoses. So I just think it's really important to go see your healthcare provider and find out what's going on with you.
Now, Walk MS is an annual event, and you take part in that every year. Now, you've been doing it for how long?
I've been with the society 5 years, so I've been doing it 6 years, so already at 10 years. That's great.
Do people ever confuse MS with the, shall we say, more publicized muscular dystrophy because of the Jerry Lewis telethons?
Yes, they think MS and MD is the same.
But there's a big difference, isn't there?
There is, yeah.
Indeed. So how does the Walk raise funds to fight MS?
Well, you can join a team, you can simply donate, but our fundraising efforts go to local programs and services to help those locally with MS, as well as research. You know, 30 years ago we had one modifying therapy. Today we have 14. So all of that research is paying off. There is no cure yet, but you know, there's so many different modifying therapy drugs that are out there for people to try.
And finally, Karen, how did Mountain Valley get involved as a sponsor of Walk MS?
Well, we do have an MS support group that meets at our facility every month, and we always do our best to support any of the neurological causes, because that is our specialty within our hospital, is anything neurological.
That's Karen Russell. She is the community liaison for Mountain Valley Regional Rehabilitation Hospital in Prescott Valley. Lynette Hoyt joining us on behalf as the community developer for the National Multiple Sclerosis Society. Walk MS once again is April 29th. Make sure you take part. Stay tuned.